Okay. So welcome everybody. Thank you very much for coming tonight. As I say, you really have exceeded our expectations with numbers. I'm Juliet Barrell and I joined HIFA a year ago to join the HIFA fundraising group, and I'll be chairing this evening's meeting. In this country, we take for granted access to some of the best health care in the world through the National Health Service. As we celebrate the 30th anniversary of the internet and all the benefits in ease of communication that brings, it's all the more shocking that thousands of people die needlessly every day due to lack of access to healthcare information. In 2006, Health Information for All, HIFA, was set up by Dr. Pakenham-Walsh with a couple of colleagues. And their vision was simple: a world where every person and every health worker has access to the health information they need to protect their own health and the health of others. Whilst HIFA currently employs one full-time person, which is Neil, and a part-time administrator, the work of HIFA could not be possible without the extraordinary support of volunteers, HIFA members and supporting organisations. This evening we're delighted to have with us just a few of these people to share their stories as to why they joined HIFA. But first I'd like to hand over to Neil to give you some background about why he started HIFA, how it works and what it has achieved.
Thank you. Thank you very much, Juliet, and it's wonderful to see so many people coming this evening. Thank you very much, everybody, for your support. So over the next 10 minutes, I'd like to explain why HIFA exists, what we're trying to achieve, and how you can help. Now, for me, the seed for HIFA goes back some 30 years. Having qualified as a doctor a few years beforehand, I took a volunteer job as a doctor for a large archaeology project, excavating Inca artifacts in the remote Andes of Peru. More importantly, I was also the only health worker for the local population, about 500 Quechua Indians. And some of them lived high up in the valley, 2 to 3 hours walk away from our camp. People would come with minor injuries, skin infections, tooth decay. I learned straight away that my high-tech medical training was not much use. I was advised by the previous doctor to bring this book, ironically called Where There Is No Doctor. This helped me provide basic healthcare to the local population, but it didn't help one small girl who was brought to me. I was in my health post one morning when a mother arrived in great distress with a bundle in her arms. She was talking in Quechua, so I couldn't understand what she was saying. I unwrapped the bundle, expecting to see a sick child that I could perhaps help. But something wasn't right. There was no movement. There was no sound. I stepped outside into the daylight to see the child properly. The child was lifeless, dehydrated, shriveled, pale, cold, dead. So I called for an interpreter. We comforted the mother and asked what had happened. Her child, a 2-year-old girl, had developed diarrhea 3 days before. During this time, they had been withholding fluids because they believed this would help the diarrhea. In a sense, they were right, because the less you put in, the less will come out. but in another sense, she was tragically wrong. If you don't give fluids to a small child with acute diarrhea, they will quickly become dehydrated, and this can be fatal. When the mother got up that morning, her child was unconscious, desperately sick. So she decided to carry the child to our settlement at the bottom of the valley, 2 hours of walking along a mountain road. But the child didn't make it. She died before they arrived. Tragically, this mother's false belief had contributed to her own child's death. I later learned that this false belief is extremely common around the world. In India, for example, as you'll have read on the leaflet that was circulated, more than 4 in 10 mothers have this false belief. And HIFA members tell us that it's common in other parts of Asia, in Africa and in Latin America. But it doesn't stop there. It's not just mothers who lack healthcare knowledge about how to treat acute diarrhea. A study, again from India, found that many doctors fail to give oral rehydration for children with diarrhea. Not only that, many of them inappropriately give antibiotics or even Imodium, which is contraindicated. This poor care leads to 500,000 child deaths from diarrhea every year. That's 1,500 every day. 10 children will die unnecessarily in the 10 minutes it takes for me to give this presentation. Almost all of these deaths are easily preventable. So, that's diarrhea. What about all other aspects of healthcare? Well, we did a review of the literature, and our conclusion was this. There is a gross lack of knowledge about the basics on how to diagnose and manage common diseases. Modern medicine, even at a basic level, has largely failed the majority of the world's population. So we have a big problem. What can we do about it? How can we achieve health information for all? In 2004, I was asked by Fiona Godley, who is now the editor-in-chief of the BMJ, to write a paper with her, which we published in The Lancet. How can we achieve health information for all? Now, there's no easy answer to this question. If you ask 100 different people, you'll get 100 different answers. Make journals open access. Make everything available in different languages. Connect everyone up to the internet. And perhaps most important of all, help people distinguish reliable information from misinformation. Because the more people are connected, the more vulnerable they are to false information. In our Lancet paper, we said all of these things need to be addressed and more. But what we also said was that it's even more important to do this within the framework of a new global campaign, a campaign we called Healthcare Information for All. In this Lancet paper, we asked the World Health Organization to lead this campaign. I went to their headquarters in Geneva to discuss what we could do. I was told that WHO would be unable to lead the campaign themselves, but if I would like to do so, they would provide us a letter of support. That letter of support was very welcome, by the way. So I left my job to start HIFA. I teamed up with Dr. Fred Bukachi, a physician from Kenya, and Rachel Stancliffe, who was then working with the Cochrane collaboration in Oxford. And soon after, we brought in Jonathan Parker, a publishing consultant. We persuaded the BMJ to give us £2,000 and we launched HIFA in 2006. Now, coming back to the WHO letter of support, the key sentence is this: HIFA is, or healthcare information for all, is an ambitious goal, but it can be achieved if all stakeholders work together. How can we do this? Well, back in 2006, email was already commonplace, with over 1 billion users. There are now more than 4 billion users of email. So we made a plan. We would set up an email discussion forum to bring together researchers, policymakers, publishers, health professionals, librarians, information technologists, patient representatives around a common cause: healthcare information for all. Ever since this launch, WHO has been our key strategic partner, and we are working more and more closely with them every year. And I'm really proud that we have 4 WHO staff on our steering group. There's Isabel and Ian, and we're going to hear from Isabel next, who are at the headquarters in Geneva. Eliane, who is in Washington, DC, and Pascal in the African Regional Office in Brazzaville, Congo. So what have we achieved? HIFA has now grown to more than 19,000 members from almost every country, ranging from senior executives at WHO to community health workers in Uganda. We started in English, and over the years we've started forums in French, Portuguese and Spanish as well, all in collaboration with WHO. So each day our members, our 19,000 members, exchange experience and expertise on these discussion forums around how to improve the quality of healthcare in developing countries. We have 12 expert working groups on issues such as healthcare information for the general public, including, of course, how to manage acute diarrhea, information for community health workers, for prescribers and users of medicines, family planning, newborn care, and multilingualism. These groups facilitate discussions on the HIFA forums. They do literature reviews, they publish papers in journals, and they give presentations at conferences to raise awareness and understanding. Just last week, Isabel and others in the Multilingualism Project coordinated a session at the Africa Health Conference in Rwanda. And next week, our child health group, HIFA, is giving a presentation at the International Pediatrics Conference in Panama. So every day we campaign with help from Chibuki, who's here. Chibuki, yes, of our social media group, to raise the visibility of healthcare information as a social issue. In 2012, we published a white paper with the New York Law School, which demonstrated for the first time that governments worldwide have a legal obligation under international human rights law to ensure that their population has access to healthcare information. A few years later, in 2015, we successfully lobbied the British Medical Association to adopt support for healthcare information for all as official policy. And just this week, we have made a formal application to the World Medical Association to adopt a similar policy. So, HIFA has been a success. We are growing rapidly, we are extending into new languages, we are managing an increasing number of projects and working groups. Much of this success is thanks to our 300 volunteers, who include our social media group, our steering groups, all of the expert working groups, our country representatives, and indeed our local volunteers also. In 2018, our total annual turnover was 50,000. This covered my full-time salary and our office manager Claire's part-time salary and all of our operating expenses. So what we need to do now with this increasing workload is to recruit a second global health professional to work with us 2 or 3 days a week to help manage our workload. To do this, we need to increase our income to a total of 75,000 this year. So far, we've raised just over half of this amount from the World Health Organization, the British Medical Association, the Lancet, Elsevier, Oxford University, and the London School of Hygiene and Tropical Medicine. And also a number of personal donors, including some people in this room. Thank you. We hope that the people of Charlbury can help us to raise some of the rest. If 10 people in Charlbury could pledge just £10 or £20 a month, this would raise thousands towards our target. I'd like to finish by saying a huge thank you to everyone who has supported this effort over the years, and particularly to Juliet, who had the vision to have this campaign, this launch appeal. So thank you very much, Juliet. And do we have time for any questions, or do we?
Yes, well, that's what I was going to say. We're going to have a question and answer session at the end, but if anybody's got any burning questions they'd like to address to Neil at this point, please feel free, because we're conscious we're covering a lot of material, so just whilst it's fresh in your mind, if you've got any questions, anybody, a question for Neil at this stage? Okay.
Am I left off the hook?
They'll think of something for later.
Great.
Okay, thank you very much, Neil. That's great.
Thank you.